Good evening, everyone. I'm Priyanjali from Prostate Wellness Team. I'm sure all of you must be keeping good health. Today, we are going to discuss a very important topic, which is renal calculi. Renal calculi or kidney stones are hard pebble like pieces of material that form in one or both the kidneys when high level of certain minerals are in a urine. Kidney stones vary in size and shape. They may be as small as a grain of sand or as large as a pea. Rarely, some kidney stones are as big as golf balls. If you have symptoms of kidney stone, including severe pain or bleeding, seek care right away. A doctor, such as a urologist, can treat any pain and prevent further problems such as urinary tract infection or what we commonly call as UTI. To throw more light on the subject and guide us on what's right for diagnosis and treatment of renal calculi, today we have with us renowned urologist Dr. P. Banu Teja Reddy, MBBS, MS, MCH Urology, DrNB Urology. He has a rich experience and hands on expertise in stone management as well as in treating urological problems. He's currently practicing at Teja Kidney Care, Banjara Hills, Hyderabad, and Continental Hospitals. Dr. P. Banu Teja Reddy has rich experience in the field of urology and carries out the renal calculi and diagnosis with utmost precision and efficiency, ensuring that the patient's health is in safe hands. And with that, I would like to welcome him to today's platform. A warm welcome to you, Doctor. Let's start with how you define kidney stones.
Thank you. First of all, I would like to thank for that kind introduction. Kidney stones, renal calculi are nothing but kidney stones. So, they are nothing but hard crystals which are formed in the kidneys due to deposition of variety of minerals. So, they can be found in the kidneys as well as anywhere in the urinary tract.
Right. Doctor, what are the early symptoms of it? Identifying a disease or a condition becomes the most toughest part when we are trying to treat it. So, how do we understand this is kidney stone? What are the early symptoms?
Usually, kidney stones, which are small ones, they don't produce any kind of symptoms. They usually pass in the urine without even knowing. So the bigger ones usually tend to cause some pain. Pain is the most common symptom which we see. And when they block the urinary tract, so then that's when they tend to
Right.
develop colicky pain or some dragging pain in the flanks, especially because the kidneys stay in the backside of the abdomen, so they tend to cause pain in the flanks. Along with that, there can be
Right.
some amount of nausea, some amount of vomiting
Mm,
also associated with the pain. So this is the classical
right.
symptom where that indicates that the stone is blocking the kidney. And if it gets infected, then there can be some fever as well. So these are the most common
Right.
symptoms which we find when there are kidney stones.
Right. And what about the cause behind it?
So the causes could be mainly dietary as well as your lifestyle. So any reduced intake of water, any diet which is rich in refined sugars or high in sodium, consuming a lot of meat, these all can predispose your urine concentration to change and predispose to formation of kidney stones. So that's why we advise very commonly to have good amount of water, limit the intake of meat, reduce your salt intake as well as have low calorie diet. Also having a lot of colas, these carbonated drinks nowadays also tend to cause increase the tendency to form stones.
Right. Right. Doctor, we know hydration plays a very important role when we are talking about kidney stones. So, does hydration mean just drinking water, or it can be any sort of liquid?
No, it can be any sort of liquid. It can be water, it can be some juice, it can be protein
Mm,
shake which you have. So it can be any kind of liquid. It can be a
right. Right.
buttermilk which we commonly have it in India. So any kind of liquid is good
Mm,
enough to hydrate your kidneys.
right. Right. Doctor, because you mentioned protein, we get to see a lot of people nowadays who are into fitness. And we also know a lot of
Yes.
people who has no idea how much protein to intake. So, can this increased amount of protein intake somehow trigger the condition?
Yeah, it does. So I have a couple of patients who were like bodybuilders. They used to take a lot of protein every single day, and they ended up in kidneys getting failed. So definitely excess amount of protein consumption is also not good for kidneys. Kidneys need to strain a lot to excrete them. So once you are consuming protein, you have to be very careful about the protein intake which you take. So it should be limited to less than, if you're consuming it as a whey protein, it should be less than a scoop which you take. And I always advise, rather than taking some form of artificial protein, it is always good to take natural protein in the form of some nuts, in the form of meat, but that's in a limited quantity, not more than 100 grams per day. So that's a good protein supplement which I recommend.
Right. Now let's talk about the diagnosis, doctor. What are the steps which we initially take when a patient comes to us?
So when any patient come to us with pain or so, the first thing which we do is clinically examine them as, is it because of kidney stones or any other things. So after that, what I usually ask for is a scan. So basic ultrasound scan it's called. So the ultrasound usually picks up the stones commonly. Along with that, an X-ray which of the kidneys. These are the two basic ones which will be required to pick up stones. So once we pick up stones, then we need to see the size of the stone, the location where it is exactly, and is it blocking the kidney or not. So sometimes we would require advanced CT scan to see where exactly the stone is and what effects it is causing on the kidneys. So once we diagnose that there is a kidney and there is a stone and the size of it, depending on that, the treatment options come into play.
Right. And what about the treatment? What if the patient has initially started just having the pain, and then we see that it's just the initial stage? So, what are the kinds of treatment which we normally, yeah,
So basically, as I told you, the treatment depends on the size of the stone, the location of the
right,
stone, along with the
right.
kidneys, the anatomy of the kidneys, whether kidneys are normal, whether the kidneys have any anomaly, as well as if there is any infection or not, like any complications from the stones or not. So if the stones are very small, usually less than 4 or 5 stones tend to pass away spontaneously. But if the stones are little bigger, like 4 to 6 stones or 5 to 7 stones, 25% of them usually tend to obstruct the kidneys. They usually stay in the kidney or block the kidney and cause infections, fevers, or so. So these 25% of stones needs to be treated. And stones which are more than 7, 8 usually 90% of they don't pass and they tend to block the kidneys. So we give them some medications to allow them to
Mhm.
pass off. So if these medications work, well and good. So we'll give the medications for a week to 10 days, allow the kidney stones to pass off, and then relieve the symptoms. If even after 7 days or 10 days they don't pass, that is when we will advise them surgery, and the man or woman will require a endoscopic procedure for removal of kidney stones. So 90% of them usually tend to pass off with the medicines. There will be only a 10 to 20% of them who usually don't respond to medicines. For them, we need to do surgery. And if the stones are presenting directly with some infection, obstruction, causing fevers, causing urine infections, causing unbearable pain, so those stones are usually big ones and they are usually stuck. So those straight away we go in for surgery, remove them with the help of lasers nowadays. So that will be a very simple procedure. It's a daycare or a single day procedure. The surgery would take a day or so, and the surgery would take an hour or so, and we usually keep them overnight and then discharge them the next day morning. So that's quite
Right,
safe. We do it endoscopically with the help of laser. We completely powder the stone off and then remove it completely.
right. So, right after 1 day or two, they can come back to the normal life again.
Absolutely, just a day. It will be only
Right.
overnight which will keep them in the hospital. The next day morning is going to get discharged. He or she is going to get discharged. After that, they are back to their routine normal life. They can do their regular activities at home. They can go back to work. They can work from home. They can go back to their regular physical activities. So everything will be normal after getting.
Right. Well, that it's that simple in today's world when where technologies has advanced drastically. Medical science has advanced drastically, and there are pain-free processes when we are trying to opt for surgery. Normally, we know people who are very much scared when they visit the doctor or when they are thinking of a surgery. But surgeries are absolutely safe and hassle-free nowadays, as mentioned by doctor. Doctor, are there also such instances where the patients they have no symptoms at all, but then they come with a different issue altogether, and then they find out that they have kidney stones? So, is it also
Yeah,
possible?
yeah. Absolutely, yeah, we do find, but that's very rare. So it's almost like 1 in 1,000 or 2 in 1,000 tend to have such things where they don't have any of the symptoms. They don't have any pain. They don't have, develop any infections or fever. But the stone will be sitting in the kidney, growing, and it tends to affect the kidney function. And at one point, the kidney function dies away as well. So that is one thing which we see. So usually, for such patients, we tend to assess the kidney function first. So if the kidneys are still functioning well, then we just remove the stones, and then they should do well after that. But unfortunately, few of them tend to lose their kidney function completely. For them, we need to remove their kidneys. The reason being, if we leave behind those kidneys, they tend to cause recurrent, repeated infections, and then they tend to
Mm.
affect the kidney function of the opposite kidney as well. So that's the reason
Right,
we tend to remove such kidneys which are very infected and obstructed from the stones. So
right.
that's the
Uh,
so it's very important to, so if anyone is forming stones, so 50% of them usually tend to develop recurrent stones in 5 years of time. So that's what I suggest. If you're forming stones frequently, you need to check them frequently as well and
right.
take a preventive measures so that you don't form them quite often.
Right. Well, that's what we always suggest our patients, our viewers. Today, we are talking about kidney stones here. But in case of any circumstances, you should always go for a routine checkup every 6 months or every 1 year. You should know whatever is happening inside your body. There are a lot of things happening in our body, and we are not aware of it. So, a routine checkup can solve most of the problems. Now, coming back to the same point again, doctor, we are talking about kidney stones here. So, does this stone form in one kidney or it can occur in both the kidneys?
No, it can occur in both the kidneys. It is not necessary that it should occur in one kidney. Most commonly, it
Hmm.
occurs in one kidney, but sometimes we do find stones in both the kidneys simultaneously. So
Right,
there is no definitive cause that it should cause in one kidney. It can be in one kidney, it can be in the other kidney, it can be in both the kidneys simultaneously. So, yeah.
right. You also mentioned about recurrence of kidney stones. We very well know that once a kidney stone patient, always a kidney stone patient. So basically, the person needs to keep that in control. So, what can be the reasons which can trigger the reoccurrence of kidney stone?
So, yeah, diet is the first most important. Hydration,
Right.
your lifestyle, it's very important to exercise as well. It's a very
Mm.
important to monitor what you eat. It's very important to have a good control on the carbonated drinks or any of such kind of liquids which you're taking, the high calorie liquids which you're taking. So if you have any family history, you need to keep that checked as well. So family history is also one good risk factor for recurrent stone forming. And along with that, if you get any routine health checkup done, if you see that your kidney is anomalous or if there is any birth defect in the kidney, you should be much more careful because those kidneys tend to form stones more often. So you need to be
Right,
much more precautious in such case.
right. Doctor, what about self medication? What about somebody, as you said, that somebody from the family is suffering from kidney stones and you need to be careful? So, what if somebody from the family is suffering from the same issue and he or she is following his or her medications? How can such scenario be harmful for the patients? Basically, self medication, how can it be harmful for the patients?
No, I wouldn't suggest self-medication really because the each scenario differs. So it would not be the same kind of stone if any of your family member is suffering from a calcium stone. There are four kinds of different stones. One is calcium
Mm,
stone, one is uric acid stone, one is cysteine stone. So each one might have a different one. So it is not advisable to take any self medications. Uh, so what I would suggest is you need to get a routine health check done, see if you have any tendency to form stones. If so, follow the advice of the urologist and monitor yourself regularly. That's what is needed.
right. Uh, so the just the last day I was watching a video in Instagram, and the in the video the person was speaking about a plant where the leaves you can make a juice out of the leaf, and if you consume it on a regular basis, it can prevent you from having kidney stones. Also, from the place where I belong from, a lot of people they have such beliefs where drinking some fruit juice or drinking some leaf juice can prevent you from having kidney stones. How true are these?
So there are some natural remedies,
Hmm.
but I don't know what kind of once I get to know what kind of leaves they are using or fruit juices they are drinking. That is when I can say something about it. But I would rather see that the part of hydration which they are getting it through that juices
Hmm.
or through those kind of liquids that mainly helps them to prevent kidney stones rather than the content which is there in them.
So, does this home remedies work, doctor?
Yeah, they do work because they're also hydrating you basically. So definitely they do work. Some kind of natural forms definitely do work, but you should be
Hmm.
very cautious in what you're taking nowadays. We don't know. You should be very careful in what you're picking up to take the as a natural remedies. Most of them are getting adulterated nowadays, so you should be very careful in choosing them and then drinking them. Definitely, some home remedies do work. Some of them which have good amount of calcium because you need to have a daily intake of more than 30 mg of calcium. So some things which has calcium like ragi. So these forms are definitely good for you to prevent kidney stones, and some
Right.
natural forms like having some nuts do
Hmm.
help, but nuts do have oxalates as well. So any high quantity of nuts or chocolates, yeah, or spinach, these tend to have oxalates in them. So high quantities of these are not preferable because they tend to form oxalate stones again. So
Right.
in a limited quantity is okay.
Hmm. Uh, Now, coming back to hydration once again, we know it's very, very important. So, let's talk a little bit more about it. How much water to drink? How to drink? We know a lot of people, uh, because they are given a target of 3 liters of water every day, they'll have 1 liter of water at once. So, can that be harmful? And can excessive amount of hydration be harmful as well? Please tell us.
Yeah, so definitely. So 3 to 4 liters is the ideal amount of water which you will be needing per day. And in that, I would suggest 75% of it is taken between morning 6 a.m. till 7 p.m. in the night. And the rest
Hmm.
25% can be taken before you go to bed. So that should be how it should be. That should be how it's divided and taken. So 3 to 4 liters a day for a normal adult who is around weighing around 60 to 70 kilos. So 75% of it should be consumed from morning 6 a.m. till 7 p.m. and the remaining 25% from 7 p.m. till you go to the bed.
Right. Doctor, we also know a lot of people who says ki, if you consume a lot of beer, it can wash away the kidney stones. So is it true or is it just a myth?
Absolutely, it's a myth. So there is nothing like having beer will flush off your stones. It's basically the fluid content in it, which is the flushing of the stones, but not the beer, not the alcohol content. So if
Right.
you rather
Uh,
if you drink a couple of glasses of water, also would do the same thing.
right. Right. Doctor, yes, we also talked about that a patient after surgery, he or she should have a proper lifestyle, a proper workout routine. So, what kind of workouts can we suggest them? Can heavy weightlifting can it be okay, or they should just stick to cardios or yoga? What kind of
No,
workout works
any what I would suggest is a moderate intensity workout. It should not be
then?
too light like a casual walking that doesn't help you. Heavy workouts
Right.
you don't need it for maintaining a healthy lifestyle. So you just need a moderate intensity workout. You can just alternate between cardio as well as weightlifting. So one day if you do cardio, the other day you can do some weightlifting or some heavy activities, heavy gym exercises. So it should be a moderate intensity workout for at least 6 days a week. So
Right.
that's what I would
Uh,
suggest for at least an hour every single day.
Right. Uh, Doctor, what if a person is delaying the condition or he's delaying the kind of symptoms he's seeing in his body? What can be the worst case scenario of kidney stones?
Yeah, so as I told you, so it's basically the complications what kidney stones can cause. That is, one is infection. It can infect your kidneys. So once the kidney infection piles up in your kidneys, it then spreads to your entire body. So once your entire body is infected, it can put you in trouble. It can land you up in ICUs. It can land you up in uh, getting advanced treatments, all that stuff. So infection is one common complication which can occur from kidney stones. Second one, if it is blocking your kidneys, it can uh, uh, your kidneys can lose their function and they can die. So when they die, then that's when you get dependent on dialysis to excrete all the toxins in your body. So that's again a tedious process and a complex thing to undergo as well. So these are the main things which you need to take care. One is infection, and the second one is the obstruction. So any of these are like alarming signs of kidney stones and needs immediate attention and treatment.
Right. Well, I can see a few questions coming up from the viewers. The first question has been asked by Roni, who asks, can sport drinks increase the risk of kidney stones?
Yes, they tend to increase the risk of kidney stones because they'll have little high calorie content in them, and the minerals which are used in them can cause kidney stones. Definitely, if they are consumed on a regular basis, definitely they can increase your tendency to form stones.
Right. The next question comes from Vandana, who asks, how are kidney stones treated in pregnant women?
Yeah, this is a very good question. So, pregnant women, one thing which we need to be very careful is in diagnosing the kidney stones because the regular X-rays, CTs, which are used to diagnose kidney stones, can't be done in pregnant women because we can't expose them for radiation. So, ultrasound
Hmm.
becomes the only modality which will be there to diagnose the kidney stones in them. So, based on that, if it is an obstructing stone, then it definitely needs treatment. So, and the treatment also varies in which level of pregnancy is the lady in, whether she's in the first trimester, second trimester, or the third trimester. So, usually we tend to put in a stent inside the kidney to bypass the stone and to prevent the obstruction. That will help the kidney to excrete the urine and it will save the kidney function. So later on, after the pregnancy is completed, then we tend to go in and remove that stone if it's still there. And tiny stones tend to clear off from these stents. So for them, we won't need to remove the stones later on. Only the stones which are big enough, which are still stuck in spite the stent being there, those needs to be cleared after the pregnancy is completed. And
Right. Doctor,
if there are small
yes, please.
stones, yeah, hydrating. That's the only thing which will help you to flush off the stones, even during pregnancy. Maximum will try to avoid the medicines in a pregnant lady because some form of side effects tend to be associated with all kinds of medicines.
Right. Uh, Doctor, what about diabetic patients or patients with any autoimmune immune diseases? We know it takes a little time for the diabetic patients to get cured in case of any condition, any disease. So, is the
Correct.
treatment a little different for them?
So if it is if there are small stones, then it would be the same. They usually tend to pass off spontaneously. It wouldn't differ. But if there are bigger stones, if there are stones obstructing, then we tend to preferably manage them surgically rather than giving some medicines, because they tend to develop infections quite easily. They tend to develop complications quite easily. So, and especially if they are some having some autoimmune diseases, if they are taking some immunosuppressive therapies or so, so that is when they have high chance of developing infections. So for them, we usually prefer going surgically and then removing the stones straight away.
Right. The next question, doctor, comes from Arushit, who asks, are kidney stone a cause of uh, preterm labor?
Yes, they are a cause of preterm labor, because obstructed kidney stones can cause severe colicky pain. So any kind of colicky pain, any kind of stress during that period also can cause preterm labor.
Right. The next question comes from Pramod, who asks, Doctor, can kidney stones cause high blood pressure?
So short-term stones usually don't cause any high blood pressure. Only long-standing stones which are blocking your kidneys can cause high blood pressure. That's because your kidneys are not functioning properly. So kidneys are very important to maintain the water and the mineral balance in your body. They are the main factories for maintaining your blood pressure. So when they are not functioning properly, definitely your blood pressure goes up. So long-standing stones which are obstructing your kidneys, which are reducing the kidney function, definitely causes high blood pressure.
Right. Right. The next question, doctor, comes from Adi Jain, who asks, can kidney stones lead to urinary tract infection, UTI?
Yeah, yeah, definitely. So that's also one common symptoms which we see with kidney stones. They tend to cause urine infection quite often, because any kind of stone has some bacteria in it. So there is a stone called Swite stone, which is mainly formed from infection. It has loads and loads of bacteria in it. So definitely kidney stones are associated with urine infections quite often. So that's what you need to be very careful. And if you're developing recurrent urine infections, get yourself checked immediately for the stones. If they are blocking, you need to get them removed immediately.
Right. So what if the patient is having kidney stones and he's suffering from urinary tract infection as well? Do we treat both the conditions at a time, or the treatments differed? Which
No,
one
no,
do we
we
treat
should
first?
definitely treat both. No, we should treat both of them at the same time, because
Hmm.
they are both are correlated. So we should definitely treat the urine infection as well as the stones at the same time. So we'll be giving medicines both for the stones to pass away as well as the infection. So if it is too severe, then we need to remove the stone and then treat the infection. But everything will be done hand in hand. Both of them should be treated simultaneously.
Right. We are talking about UTI here. Again, hydration comes back in this scenario. Hydration is very much important when we are talking about UTI as well. Any other thing which can be helpful for UTIs? We have heard cranberry juice can be very much helpful. Is it true?
Yeah, it's very much true. Cranberry juice, cranberry fruits. I would suggest cranberry fruits more than the juice, uh,
Right.
because direct form of consumption will definitely help you to prevent urine infections more than the juices and the cranberry shakes and the cranberry drinks as well. Along with that, other remedies which are very important to prevent urine infections would be not holding urine for a longer time, especially the women. Women tend to hold urine for longer time because of various reasons. So holding it for longer time will increase your risk of UTIs. Having constipation regularly will increase your risk of UTIs. And proper hygiene proper maintaining proper genital hygiene is also very, very important to have
Right,
to prevent urine infections. So these are
right,
the
right.
these are the most utmost important things which needs to be maintained. Having good hydration, avoiding constipation. So you can avoid
Mm,
constipation by having high fiber rich diets, having good amount of fruits, good amount of green leafy vegetables, reducing the meat content, reducing the sugar content. This will help you to have good bowel habits, reduce constipation, and not holding urine for longer time. So these are the remedies which are very important to prevent urine infections.
no, what about smoking and drinking, doctor? Can it also trigger the condition?
So directly per se, smoking and drinking are not associated with forming kidney stones, but they're to maintain a good health, definitely you need to have a very controlled habits. That is, it's better to avoid smoking because it tends to predispose your bladder. It changes your bladder function. So it has a lot of
Mm-hmm.
toxins in it, which affects your bladder and kidneys. It tends to cause cancer. So definitely no to smoking and alcohol. Very, very limited. So I would suggest just 30 or 45 ml per day, not more than that.
Right.
But directly,
The next
alcohol
question.
doesn't
Yeah.
has any relation to hormones.
Right, right. Well, anything under control can be managed, but whenever you're taking anything out of control, it may be water as well. It can be a little critical. So anything out of control can be harmful for our body. Moving ahead with the next question, which comes from Suraj, asks, is there a genetic predisposition to developing kidney stones? I think we have already talked about it, but then do you want to throw any more light on it?
Yeah, especially this is especially we see in kids. So any children developing stones, they're forming stones recurrently. We need to analyze them.
Hmm.
We need to get a checkup done for various minerals in their body. We need to get their electrolytes checked. We need to get their urine checked. We need to see if they are having any mineral abnormalities, and we need to correct those mineral abnormalities. So this is very important. So genetic predisposition as well as familial predisposition should be evaluated as early as possible to avoid formation of recurrent kidney stones.
Right. And I think with that, we have the last question, which comes from Pankaj Mehra, who asks, how does low sodium diet help in kidney stone prevention?
So because low sodium diet is basically low salt diet. So when you have low
Hmm.
sodium, the concentration of the urine tends to stay alkaline. So that's when the stones won't form. So it's very important to keep your kidneys pH maintained. So if you have low sodium in your diet, so your kidneys concentration will be maintained at an optimal pH, and you'll not form any kind of stones. So that's the reason
Right.
why we stress on having a low sodium diet.
Right. So I think these are the small changes which we can bring in our life, having a proper hydration. Also, we have a lot of apps which where you can set alarm whenever you want to have water, or they will just set an alarm for you. You can always have the notification on your phone that this is the right time to have water. Hydration is very much important when we are talking about kidney stones. Having a proper lifestyle, getting up in the right time, sleeping in the right time, getting ample amount of sleep, staying away from stress, which becomes a little tough. But then we can try and make this little changes. Diet plays a very important role. We try and stick to having home cooked food, just ghar ka khana, and avoid junk food. Obviously, avoid fatty food, low sodium, as we have heard from doctor already. So these are the basic changes. If we make in our life becomes much more easier, hassle free, and away from any medical treatments as we want our life to be. We had a wonderful discussion with Dr. P. Banu Reddy, Teja Reddy today. And before we take a leave, Doctor, any take home message for our viewers who has watched us so far?
Yeah, so it was a very nice interaction which we had. Um, all the questions, I hope all the questions are answered. And if any one of you
Yes,
have any
yes,
further
yes.
questions, you are you can feel free to contact me. You can contact me through the same name through any of my social media platforms like Instagram, Facebook, WhatsApp, or you can get an online or a video consultation with me through the Continental Hospitals as well as Teja Kidney Care website. So the most important things which I would like to tell is good hydration, regular exercise, controlled diet, and if you are a diabetic or hypertensive, maintain your sugar levels at normal range. And if you are having blood pressure, do take your medicines regularly. Have a good exercise regularly. Maintain your health. Get regular health checkups done. If you're a stone former, you don't need to be worried because majority of the stone formers tend to do very well. The dietary habits, the medicines tend to keep them healthy all the time. It's very few of them which who will need the surgical treatment. The surgical treatments are also very well advanced now. They are just simple procedures with very minimal complications. So if you are any one of you going through the surgeries as well, you need not be worried much. So you tend to do well. So have a good health and get keep your kidneys and yourself hydrated and stay healthy, stay safe. Thank you.
Well, that was the expert advice for today, and that was Dr. P. Banu Teja Reddy for us. Thank you so much, Doctor, for your valuable time. It has been a very informative session for our viewers today, and we look forward to many more such sessions in coming time. Also, thank you, viewers, for your excellent participation. For more information and updates, stay connected on our Facebook page, Prostate Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you. Stay safe and stay healthy.
Thank you.